solving health problems, tuberculosis.
Tuberculosis is a bacterial infection caused by a germ called Mycobacterium tuberculosis. The bacteria usually attacks the lungs, but it can also damage other organs. Most people infected with the bacteria that cause tuberculosis have no symptoms. When there are symptoms, they usually include a cough, hair loss, night sweats, and fever. Treatment consists of antibiotics. Treatment is not always necessary for those who do not have symptoms. Patients with active symptoms will require a long process of treatment with various types of antibiotics. More than half of the municipalities in the country report cases of tuberculosis every year. There is a particularly tuberculosis in the entire Mexican territory. However, the states with the highest numbers of new cases and deaths from this cause are Baja California, Veracruz, Guerrero, Sonora, Tamaulipas, Chiapas, Nuevo León,
and Tabasco.
Hey, the transmission of pulmonary tuberculosis is by air. When a patient expels drops of saliva with the bacteria when coughing and talking, singing, or sneezing near other healthy people. One measure to reduce the risk of infection is for people to cover their mouths and nose when coughing or sneezing. Tuberculosis is a passive-aggressive disease. As it does not present first-hand symptoms, it can take the affected person by surprise. Due to the coronavirus pandemic, all diseases transmitted by air have decreased in large quantities. This is due to the prolonged and forced use masks, the latter being the answer for the eradication of tuberculosis.
In the large cities of Asian countries such as Japan, China, and Korea, the use of masks was very common even after the pandemic. This made bacterial diseases almost null in their cities, including tuberculosis. This is a measure that our country should take. The government of Mexico should instill the use of masks on a regular basis in highly trafficked public spaces on any occasion, not only during the coronavirus pandemic. But this sounds unlikely because the measure would not be socially accepted.
A more logical and viable option would be the large vaccination campaigns throughout Mexico. Currently, vaccination for the prevention of tuberculosis is completely free in any public health center, but it does not mean that everyone has access to it. Rural or remote communities, society to find them is practically impossible. Another problem that arises is people's ignorance and misinformation. In Mexico, more than 30% of the population does not believe in the effectiveness of vaccines or thinks that they are harmful. This is a problem of lack of information.
It is important that those affected by tuberculosis complete with all the time of the treatment and do not abandon it, since the disease can reactivate and become drug resistant, which implies a new treatment much longer of 2 or more years, and with drugs that involve an injectable at least 10 months apart from the adverse effects of the rest of the drugs in this drug-resistant situation. In conclusion, tuberculosis is treatable and curable. Our country offers many measures against this disease, such as vaccination and prevention, but these are not in the best stage. The government should encourage the use of masks regularly. It will have to prepare the country teachers to inform correctly and clearly about tuberculosis, its symptoms, and its prevention. A massive vaccination campaign will have to be carried out. so that all rural communities in Mexico have access to a cure for tuberculosis, and this ends the problems and deaths that are caused by the disease in Mexico.